The issue is violence towards kids in Jamaica during pandemic COVID-19. The COVID-19 pandemic may have entailed major changes for many kids and their families, not just because of the lockdown, restricted measures, social isolation, changing demographics and the reduction of available health services, but also due to the sudden and possibly long-term increase in child poverty and family uncertainty. Stay-at-home orders intended to protect the public and prevent widespread infection left many violence victims trapped with their abuser. Due to that, the kids cannot tell anyone about the abuse due to the stay-at-home orders.
The reason of the pandemic put Jamaican children at heightened risk of abuse is financial problem. Parents and caregivers experience increased financial stress as a result of job or income loss. It is because the pandemic spiked early this year, many of the companies need to reduce their operation and need to lay off some workers, while the people who were self-employment, their income will be decreased. When this happens, they need to spending more time at home. This will put the children at increased risk of being abused by a family member or caretakers. As when they stress, they tend to take out on their children, which lead to the next reason of this issue.
School is the setting in which children spend most of their day outside of the family, and therefore is a prime factor of children's adjustment and functioning. In addition, academic achievement is a salient aspect of children's self-worth, a strong deterrent to deviancy and a robust indicator of social and economic potential. Therefore, the quality of the school experience is a key ingredient in identity development, morality, and interpersonal relationships. For the children experiencing any type of abuse, before the pandemic, they were under watchful eye of a guidance counselor, a teacher, or even someone in the community. Now, children are isolated and unable to communicate as freely as they could prior to the pandemic. They are in close proximity with their abusers, oftentimes unsupervised. Or if caregivers are aware of abuse, they may not want to take the risk of going out in public and contracting the disease to make reports to the police.
We agree that COVID-19 puts Jamaican children exposed to the abuse. Because of this pandemic, mostly primary and secondary schools in Jamaica is closed and over 500 children transition to remote learning. Therefore, they spend more time at home, and this make them exposed with abuse, especially when their parents have been identified having negative self-representation and low empathy. That will make the parents more likely to be aggressive towards their children.
Comment for that issues is yes, agree. It is because unsafe environment. Family economic status make a powerful effect on family functioning and child development outcomes. The strains of poverty may contribute to parental mental health problems, which in turn elevate negative parenting.
For the suggestion, first, a government-led emergency cash transfer program for informal workers in urban areas has provided a lifeline for parents struggling to put food on the table. Families that receive cash transfer are better able to access food and regular health care and to send their children to school. They are also less likely to suffer from debilitating stress, which can lead to violence and poor mental health.
Lastly, a government should provide parenting programs. Parenting programs are found to reduce risk factors, specifically in effective parenting, and enhance protective factors such as endorsement of appropriate child rearing attitudes, positive parenting, and parent-child interaction.